At this time, I'm going to turn it over to Dr. Royster.
Thank you, Ms. Levinus Wells. Share with you, as we have done most of the meetings the last several months, including some special call meetings. We'll share with you an update of where we are positioned relative to COVID and progress in the schools, how the community spread is or is not affecting district operations. First slide I'll share with you, you all have grown accustomed to seeing. And for the new board members, spend just a few minutes with this. This entire matrix was developed by our research and evaluation department, Dr. McCreary's office. Now, unfortunately, Dr. McCreary is not with us this evening. He had a death in the family and he's not able to be with us. But I think someone's on from his staff if there's some aspect of this that I can't explain to you or you have a question about the statistical comparison. Basically, what we do in this graphic is we take our population and utilizing the same methodology DHEC does to make a county of less than 100,000 mathematically comparable to a population of 100,000. We do the same thing with our population inside the system. And then we compare our population inside the system with the county and with the state. And you'll see that we look at the incidence rate per 100,000. And in here, you'll see the number of cases in Greenville County, the number of cases in South Carolina, and the number of cases in Greenville County schools. In the first section, you'll see the 2-week rate and the 1-week rate for Greenville County. And you'll see that expressed as a per 100,000. For example, looking at the last week, there were 15,337 new cases in South Carolina, and there were 2,123 confirmed in Greenville County. The 2-week incidence rate for the state was 297.9. For the county, it was 405.5. For Greenville County schools, it was 206.2. For those of you familiar with or keeping up with the DHEC definition of low, medium, or high, you'll recognize that 206.2 is just over the threshold for high. It is at the highest end of medium or the lowest end of high. You'll also see the trend in the incidence rate from Greenville County schools, Greenville County, and the trend in South Carolina. For example, the week of 11/4, our trend went down 10% and only increased by 2% in the following week. And you see how that compares to Greenville County. It had a 0% increase the week we dropped 10%. The state had only a 2% increase. The week in which we had a 2% increase, the county had a 25% increase, and the state had a 14% increase. Again, all based proportionally per 100,000. Then you see the prevalence rate per 100,000 expressed as a number. And that's the positive cases per week compared to 100,000. Using 100,000 as the constant rather than the number of tests given. Because we've gone through periods of time where, quite honestly, people were encouraged to get a test only if they felt symptoms of illness. And other periods of time when people were generally encouraged to take a test. So if you draw that comparison in a period of time where, well, we only want you to get tested if you have these symptoms, you're certainly going to have a higher positive rate. So we go back and place that on a per 100,000 comparison. So basically looking at the positivity rate within the population as a whole. Then the last two are unique to our analysis. We use an attack rate. Dr. McCreary's office is established giving a statistical analysis of how the disease is attacking our population. And you see there that our numbers, again, are lower than the county and lower than the state. In fact, if you look at 1111, you will see that we're at 0.0021, county's at 0.0041, and the state is at 0.0030. And the last two numbers, the last two columns, reflect our risk ratio. That is the risk inside the system as compared to outside the system. Now, the number inside the system includes everybody inside the system that tested positive, without regard for where it might have, what the point of origin might have been, inside or outside the system. If that number were the whole number 1, that would mean the likelihood of you getting it inside if you work inside our system, your likelihood of getting it is equal to, exactly dead equal to, that of the group we're being compared to, whether it's the county or the state, if it was the whole number 1. So you'll note that comparing us to Greenville County, our risk ratio is 0.51. It lacks 1/10, being about half the risk. When you look at our risk ratio versus the state as a whole, it is 0.69. So approximately 7/10 of the risk, the population as a whole in South Carolina. And like many other things in our state, there's great disparity within the levels of COVID in communities in South Carolina. There are some communities that are at low. There are some large communities, I believe Charleston County being one of them, that are actually at a medium. But we're in a high in our county. Now, to make this a little less complicated, we just looked at the last 3 weeks. So this is simply a look at the last 3 weeks, because that obviously would tell a little more current story about where we are. And you can see the link at the bottom indicates where you or any member of the community can find this data, whether you work in the system, you're a parent, or you're just interested in knowing about it. We update that weekly. We now get the reports from DHEC on Thursday afternoon as opposed to Monday. Request that we, along with other school districts, made of DHEC early on in the process. So we had the numbers before a weekend instead of just after a weekend. You all have become accustomed to seeing this graph, and that simply is a graphical representation of our employees quarantining and isolating. And you see by the color, red means isolating, that is, you have tested positive. Yellow, kind of a yellow gold line, is quarantine. You've been exposed to a person who has tested positive. Obviously, that's going to always be the higher line of the lines on this chart. The other 2 lines are new quarantines caused by school exposure, which are relatively easy to track, and new quarantines that were as a result of not being exposed at school. And our experience throughout this whole process has been the larger number quarantines result from activities or behaviors outside of school. In fact, you see that green line approaches 0 many times during the course of the period 10-15 through 11-15. For a particular group of employees, Mr. Lewis asked this question the other day. Cumulatively across the 14 high schools for the period August 27th to November 13th, 9 coaches have tested positive for COVID. 5 are regular employees, 4 are adjuncts. 52 coaches have been quarantined due to exposure. That's 31 regular employees and 21 adjuncts. Now, when we say coaches, this would represent only coaches in season, i.e., if you were the track coach and you didn't coach any other sport, they're not running track right now, and you tested positive, you would not be included in this number. These would be coaches who it's either their season or it is an open season for practice for them. Here's looking at our employee isolating data broken down by teacher, which is the green, and that kind of washed out pinkish color are the non-teachers. For example, on 10/19, there were 6 teachers, 2 non-teachers. On 11/15, there were 2 teachers and 2 non-teachers. Again, isolating, they've tested positive for the virus. Student quarantine data, quarantine and isolation data, same type graph. But up there, you'll see the huge difference in the number of students quarantined. You'll see we peak out right at 700, and it has declined a little bit in the last week. Isolating, the red line, just like the employee line, the kind of yellowish gold line is the quarantining in the highest line. Then you'll see the blue line, new quarantines not related to school. You'll see peaks and valleys in that. New quarantines caused by extracurricular exposure, almost all athletic. You see there's some peaks and valleys to that. And then you see the ongoing quarantine line. I'm sorry, I've already covered that one. The new quarantines not related to school. Quarantines related to extracurricular, and new quarantines caused by school exposure, which is the green line, and it sits really close to 0 on most days. And there are some spikes in there. Remember, that's a 100-point scale that you're looking at. All right, this gives you a little closer look, which shows you some of those really small blips are actually about 20 students. Same definitions, red for isolating, green new quarantine school exposure, blue new quarantines not related to school, and yellow new quarantines caused by extracurricular. Most cases, those spikes, whether they're internal or external, are caused by, generally speaking, a single or 2 to 3 events. It might be a team or 2, perhaps 3 teams. Generally speaking, the spikes in the community have been mostly related to students attending the same daycare or aftercare, most of where there's been a large spike, most of those. All right, now looking at our student isolation data, new isolating school exposure, new isolating non-school exposure, new isolating extracurricular exposure. So green, school, that faded pink, non-school, and the orange, shaded orange color, extracurricular exposure. Again, isolation being students that have tested positive. Same look, but at quarantine. So students that are quarantined, they're out for 14 days because they've been directly exposed to someone who's tested positive. And again, you see the green, new quarantining, the orange, extracurricular, and the faded pink, non-school. So on a peak day there, you will see 57 and to get it where I can make that a little bit bigger. I don't think I can do that. I don't believe we have the ability to make these bigger on here, do we? You may have to look on your screen to see that more closely, but it's 57, 32, and 2. Let's see if we can't get a little larger representation of that, a little easier to see for next time. Now, a huge issue, a great concern that we have, when you start looking back at those numbers of employees that have to quarantine or isolate, those numbers get out of hand. They can fairly quickly cause us a problem by not having enough teachers in the classroom. So to give you sort of a point of reference, We've had 329 subs that have resigned or moved to inactive status this year. We have 400 substitutes that we've hired. We have 129 more in the pipeline. All right, so that leaves us with a pool of 1,594. 673 are certified, 921 are not. However, of that nearly 1,600, 900 have not worked this year. In other words, they didn't resign, they didn't move to an inactive status, they're just not taking jobs. That leaves approximately 700 active subs plus those in the pipeline. Which you compare that, we get those 129 in, 829 compared to 1,642 in March of last year. And what are we doing about that? Well, we have no open and closed windows to apply to be a substitute. It's open all the time. We have ongoing recruitment efforts and job fairs. We're contacting all the fall student teachers to add them for the spring semester. We're sending a message to all parents with information on how to apply to be a sub immediately following Thanksgiving. I figured that might be at the top of people's mind going into Thanksgiving or during Thanksgiving, but just after Thanksgiving. We're also soliciting from principals, individuals that we might reach out to that they might be aware of. We also believe that our return to in-person with elementary and now with the phased in for middle school students should make available to us some subs who are parents. Another point of information that we now have is we joined in this Qualtrics dashboard. You see there's a partnership with AASA, which is the School Superintendent's Association, NASSP, the Secondary School Principals, NAESP, which is Elementary School Principals, Brown University, and Qualtrics. Now, if you want to go directly to look at all this, you can see the link there at the bottom. Here is the most relevant information. Now, we've only been in it 2 weeks. We've submitted our first 2 weeks data. All right, a reporting period, October the 26th through November the 8th. At the bottom, you will see the national sample size. Enrolled students, in-person students, and staff in buildings. They have done their comparison on a per 100,000. But it's the per 100,000 of those numbers that you see below. Greenville County Schools, our student case rate daily is exactly even with the participating districts nationwide. Now, we don't remove our data, so we're in the 17 of the participating districts. Our number would be included in that, just like it is of staff case and community case rate. Staff case rate daily per 100,000. Ours is 20, and the average of all participating districts serving 8.7 million students is 27. Community case rate in school matched population, 28 in our community, and it's 19 district-wide. Gives you another point of comparison to a much larger database. What are other districts doing in our state? Currently, of the 80 regular school districts, this does not include the charter district because, quite honestly, all of those schools operate independently within that charter district. So they do varying things. So we've excluded the charter districts. 19 are full face-to-face, which is 24%. 1 is fully remote, and 60 are operating under some form of hybrid schedule. Of the 10 largest districts in the state, which represent 48% of the student population, 3 are on full face-to-face, enrolling 31% of the students in the total of the 10 largest districts. And you all know we belong to a consortium of similar school districts. Some of the rules about that consortium, though there are a couple of exceptions when you look down through there and see it. Generally speaking, they are county-wide. They have to have diverse populations. You have to be invited to join and part of the invitation and vetting process is you have to be performing at a high level. So you'll see the member consortium districts. You see them grouped by what they are doing. So you'll see all students 5 days in person, Mesa, Arizona, Gwinnett and Fulton counties in Georgia, and the school district of Palm Beach County. You'll see that we are a combination of in-person and hybrid. Wake County is a combination of all three options. Cobb, Chesterfield, and Virginia Beach City, all students are hybrid. Charlotte Meck, School District U46, which is the suburban Chicago district, Fairfax County, Virginia, are hybrid and 100% remote. And then Cumberland County, North Carolina, Boulder Valley, Colorado, Montgomery County, Maryland, Bellevue, Washington, Baltimore County Public Schools, and Beaverton, Oregon are all 100% remote. So we'll check in with what they're doing. That's a little different way they're looking at it. 6 districts remote, 33%. 4 districts, 100% face-to-face, 22%. 3 districts, 100% hybrid, 17%. 3 districts are operating with oldest students 100% remote and youngest students on a hybrid. 1 district is operating on all 3 schedules, high school 100% remote, grades 4 to 8 hybrid, grades pre-K to 3 100% face-to-face. And we're operating a little bit differently from all of them, is with the oldest students on the hybrid schedule and our youngest students with our latest move, full face-to-face, are being phased in at the middle level. We are the only district of the 18 that did not start the school year 100% virtual. So our next step, which we announced yesterday, so we phased in return of middle school students, starting with the 6th grade coming in 2 days in person, face-to-face, in full next week. Of course, there are only 2 school days in the week. The following week, the 6th graders would be in 4 days, and we would bring back the 7th graders 2 days. The following week, the 8th graders would come in 2 days full in person. The 6th and the 7th graders would be there 4 days. Fridays would be remedial compensatory time for students needing that, and we would provide transportation. Following the Christmas holidays, all middle school students would return, as you see there at the bottom, face-to-face 5 days a week, Monday through Friday. Now, all that is predicated on us continuing to post reasonable numbers within our system, our ability to be able to continue to staff our schools, and assuming there is not a skyrocketing spread after Thanksgiving and Christmas, which a number of people are predicting may occur. If that were the case, we might have to shift from this and what we're currently doing for some relief period of time to go to 100% virtual. And when we came back, we would come back to where we are going out, not go back through, likely go back through 1 or 2. We have the same protocols in place for middle school students and elementary face-to-face because of being able to utilize those plexiglass configurations. We're providing the same protocols we provided in a 2 or a 1, i.e. we're keeping students 6 feet away from each other and 6 feet away from their teachers. And we're following the mask requirements when you can't maintain 6 feet and following those mask requirements inside those plexiglass modules. We fully believe those are the reasons that our numbers are lower than the community. I also believe that's a reason our numbers are perhaps lower than those in the group we're participating in nationally that has such a large number of students and districts included in it. We hope it doesn't come to that, but we've got to closely monitor what occurs during the Thanksgiving holiday, during the Christmas holiday. We'll continue to do that just like we do now. Now we get reports on a daily basis of potential quarantine, potential isolation. and respond to those. We respond to them over the weekend, after hours, and that will continue to happen over the holidays. Hopefully, we do not have to regress, and that the spread that some people predict will not dramatically increase or occur. High school increase to in-person instruction. Our most challenging area, you all will recall that there are more than 500 classes at the high school level, not including things like band, chorus, PE, weightlifting, not including classes we normally think of being large. There are more than 500 that have 26 or more in them. It is more difficult to utilize those plexiglass configurations because of the size of the students and the amount of space they take up. In fact, the plexiglass to meet the DHEC requirements for older or larger students, which could also apply to large middle school students. Those configurations are a foot longer and a foot higher. But we do believe that we have a straightforward path, maintaining the appropriate protocols, using that plexiglass where we can, moving students where we might could move them. We believe that we have the ability to get back to somewhere between 60 and 75% in person, as opposed to the current 40% in person. We're working through that right now. It has to be done school by school, literally class by class, classroom by classroom. We hope to have that plan ready to announce before Christmas, and we will begin second semester operating under that plan. In the meantime, you know that remediation is occurring at both the high school and the middle school level and at the elementary level as well. We also have completed our benchmark testing, and when we provide you all a report most likely at the December CAL, we should have an analysis of the benchmark test. That early analysis in looking at that indicates that the comparison between last year's benchmark and this year's benchmark does not reflect that dramatic drop in failing grades. Because again, benchmark measures student knowledge related to the standards and has nothing to do with whether they've turned work in or not. There's some drops there. There are actually some increases there looking at the early analysis, but it is not aligned with the same failure rate that we saw in first quarter grades. So we believe we will have that analysis completed. We may also have an update to student work that's been done in the interim from the end of the first grading period to about perhaps the midpoint of the second grading period. That concludes the things that I wanted to make sure that I shared with you, and certainly we'll take any questions that you all might have.
Any questions? Ms. Michelle Goodwin-Conwell, sorry. I think we're coming with the mic.
The number 100 and 500 sticks out with that asked back in October. And you said that if it went over, if it got to 500, you would be real concerned. And it's at 673 now. Is that the same, the prevalence rate per 100,000?
It's actually at 206.2.
Okay, what's the 673.9? The prevalence rate? Because one of them, I couldn't remember what it was. One of them, it was if it got to a 1.0, what was that?
All right, the 1.0 is the risk ratio. Those are your last two columns. A 1 means there is equal risk inside the system to outside the system. And currently we're at about half the risk inside the system versus outside. That's the 0.51 compared to a whole number 1.
So the 500 is the first one?
The 505 was the 505 was the high point before we ever started looking or had the ability to look at the inside the system at the numbers. That was the high point when we designed the plan this summer in the community. So hence that led to my remark that at that point we'd be very concerned if inside the system we were at 500, which was an extremely high point out in the community. I think that might be what you're recalling.
Okay, let me ask you this: with why did we make the decision on middle school to go back now instead of waiting until after Christmas break?
Well, quite simply, when we look at the number of failures we have, if we look at the amount of time students are out of school that they would normally be in school, which is 60% of the time. And we also saw that we had a path forward that keeps in place all the same protocols we have for a 2. So it's we believe keeping people safe. We couldn't in good conscience stay where we were, which would have meant if we waited that we would have kept those students where they are for a full half of a year. Now, when we said that, what I said to a group of teachers I met with last week, what I said to the media yesterday, what I said earlier in here, if these numbers start dramatically increasing, we may have to go backwards and we may have to do it very quickly. In other words, we may not be able to give you a week's time to prepare if we have to turn backwards quickly. But if we're keeping people safe and all the data says to us we're keeping people safe, then I could find no good reason not to move forward. Might people have felt better about it? They might have. There's some people that are not comfortable with this. I think it's safe to say a lot of people are not comfortable about the whole coronavirus COVID issue. I think there are places I go in where I'm not comfortable. I don't feel unsafe. I'm not comfortable with it. And that was a question we asked them. We asked them, are you comfortable? And what would make you more comfortable? And the only really actionable item we got out of that, there were 3. One was there was a feeling by some people that taking temperature would make them feel more comfortable. So we've said to the principals, talk amongst your faculty, and if there is a consensus we want to do that, we may put that in place. The second thing was a concern that middle school students would not follow the protocol. We haven't had an issue with that at elementary to any great degree. And so a suggestion was made that student and that parent sign that they agree to do these things. And if you don't follow through, and we're not talking about somebody that forgets to do it, but you just refuse to do it, or you have to be told 10 times, then you'll be assigned to the virtual program. And the student would sign that and their parent would sign that. We understand these are the parameters. We've got to follow these guidelines. We're going to do that. The third thing was, we'll just feel better about it if we wait till second semester. And that one, I do not believe that would be in the best interest of our students. And I don't think it substantively does anything. It's not like we're going to have something in place second semester that we don't have in place right now, or the ability to put something in place second semester that we don't have right now. So I understand their concern. They're concerned because their students move more. They're going to move in one direction and move as quickly as they can reasonably move them. They were concerned about the cleaning. When you come in as a student, you clean your area off, and when you get up, you clean it off again. So every student cleans up for themselves, coming in and going out. And that's not put on the teachers, because the teachers can't do that and supervise the coming in and the going out. And we don't have enough custodial staff to go in and clean every one of those modules between classes at the middle school level. So that alleviated some concern, I think. Again, we're watching this closely. If we believe this wasn't safe, we would not move forward doing it. And we may very well have to turn quickly.
So what I heard you say is that y'all did get the information from them as to their comfort level?
We did, and their comfort level didn't go up since the last time we asked them. In fact, it went down. As a result of that, I met with the principal and 2 teachers from every school, every middle school in the district last Friday. And I thought we had a good conversation, about 2 hours long. And again, I think they would feel more comfortable, but we got to balance their comfort with what's the best thing to do for our students, realizing that we're not going to do something to threaten their safety. I understand they'd feel more comfortable. They probably would feel more comfortable if we delayed it further than that. That's just, I think, human nature. But we believe we have everything in place because we're doing exactly what we did to bring students back. And what changed for us was being able to put them within these plexiglass configurations, which equals 6 feet. Now, it took longer to do it in middle school because it's more complicated. We had to move classrooms. We had to change some student schedules. We had to do a number of things that we didn't have to do at elementary schools. And we're phasing it in. We're not bringing them all back at one time.
So when the parents are asking us about us not going by the roadmap, was that put in there to let them know that at the beginning of the year that we would be changing these type things as we could get them back safely as possible?
Certainly talked about that with them. In fact, we just did a video that we sent out to all employees where we talked about that roadmap. And we talked about how during that roadmap, when new strategies become available, we implement them. It would be wrong, and I know you would not want us to ignore actions that we could take that are now considered safe that we didn't know we could do in July. If DHEC had not said you can use this plexiglass configuration and using that and wearing a mask and maintaining 3 feet, that is equivalent to physically 6 feet. We would not be where we are now with elementary or with middle school. It would be negligent on our part to disregard that, I believe.
Okay. That's all. Thank you.
Mr. Suddeth?
With the elementary schools, they're all right now, Dr. Oyster, attending 5 days a week.
Yes, sir.
Are we having any problem with the teachers
No, sir.
teaching those students?
No, sir.
If we go to the middle school, we're going to have, I was right here, they're going to be attending Monday through Thursday.
Yeah, yes, sir. Up until we come back from Christmas holidays. Yes, sir.
Why are we doing e-learning on Fridays?
On Friday with the middle school students, until we get them all back in, we're going to do remediation in person in the school. We're also providing transportation for that. We have some cases at the middle school level where we would have teachers that were trying to do both because they're teaching more than one grade level. So until we can get them all in, we didn't want to bring them back all at the same time because I do think that would overwhelm the teachers and the staff. Until we can get them all back, that is all 6th, 7th, and 8th grade at the same time, it's not possible for us to do that and operate what we need to operate on Friday. So we're leaving Fridays for remediation until we come back from Christmas break. Then they'll be face-to-face 5 days a week, assuming we don't have some real issue with community spread or in the building spread.
I don't understand why we don't do that 5 days a week. We're taking Fridays for a short period of time to just simply do the remediation.
We're doing remediation and they're still doing e-learning up until the final group gets back in because we have teachers that are split amongst grade levels in middle school.
Would it be better to have them in 5 days?
Yes, sir, but it wouldn't be practical to get them in 5 days and phase in their return. We can't do both.
having a problem with the teachers in the middle school?
Well, at this point, we don't. I mean, we have teachers that are concerned about it. We have teachers that feel uncomfortable about it. But until we actually start doing it, we don't really know whether we'll have issues with teachers. We hope that we won't. I think most of our teachers are committed to being there and to doing what they're supposed to do. And they're going to do those things even though they might feel a little uncomfortable about it.
In the high school,
Yes, sir.
you look at, if I understand it, 65% of the teachers say they don't want to go back. 35% say they will consider it.
We didn't really ask them that way. We asked them the following question. We asked them, how comfortable are you returning face to face? Comfortable, somewhat comfortable, somewhat uncomfortable, uncomfortable. That was the question.
Somewhat uncomfortable and uncomfortable, isn't that not 65%?
Yes, sir.
And those that said that they are would be 35%.
Yes, sir.
If I've got students going back 5 days a week, but I only have 35% of the teachers, then we're going to be defeated before we ever start. If you just believe that, or do you think?
Well, I'm not correlating I'm uncomfortable with I'm not going to do it. I think you've got a lot of teachers that are not 100% comfortable with it, but they're still going to do it. There may be some that won't, but I don't, when you ask somebody if they're comfortable or they're not comfortable, or they're somewhat uncomfortable or they're uncomfortable, again, as I said, I go in some places, I'm maybe a little bit uncomfortable being in there, but I'm going to do what I'm supposed to do, take care of my business and go on, because I'm going to keep my 6 feet from the next person and wear my mask. And when I get out to the car, use some hand sanitizer. So I might walk in there and nobody's doing any of that. So I might be a little bit uncomfortable, but I still went in and did what I needed to do. And I made sure that I followed the protocol. We're going to make sure that our students and our teachers follow the protocol.
Where are we going to start with the high school?
We will have our plan. We believe we can announce it before Christmas. And our plan is to have them back greater than 60% of the time by the second semester.
Why just 60%?
Because there are so many of them, they are so large, they're in such large classes, we can't move them independently. The middle school level, you can move the 6th grade, get them settled. Then you can move the 7th grade, get them settled. Then you can move the 8th grade. The only way you can move high school is you move them all at once. In some buildings, that puts, even with a reduced attendance level with some in virtual, that puts as many as 1,800 students in the hall at any one time. And we believe we can get far more time in than we've got now because of using plexiglass, moving some students around, doing some changes effective second semester. So we think we can get that number between 60 and probably between 60 and 75% of the time, as opposed to 40% currently.
Plexiglass, and we don't have to be 6 feet, we're 3 feet, is that right?
Yes, sir.
Right. How many more would that get the students to be in the school?
Well, we believe it gets
without the plexiglass.
Without the plexiglass, without the plexiglass, and at 6 feet, we're doing about what we can do right now. With the plexiglass, we believe 100% elementary, 100% middle school, and somewhere between 60 and 75% of the time in person for all high school, not 60 to 75% of them full time, but all of them 60 to 75% of the time.
What's our plan dealing with all those students who got L's the first 9 weeks?
One thing is going back, having them turn in work that they neglected to turn in, do work that they neglected to do, and then we're doing remediation. We're doing remediation at elementary, middle, and high school level. And right now, they're using Fridays for remediation at the high school. They're also using, I believe, Mr. McCoy, they're all doing two days a week by subject area in the afternoon and on Fridays. Am I recalling that correctly?
We get through with the school year, how are we going to know how well the students have learned, what they have learned?
We'll have their grades, which is one indicator, and we have the benchmark testing, which we're prepared, I think will be prepared at the December CAL to share with you the results of the benchmark testing, which is really more a measure of what they know related to the standards than the actual classroom grade is. We'll also have the in the course grades that would be related to the high school level.
I'm interested in knowing what the students would know at the end of the school year.
That we would know those things.
So, and be able, can we compare that with past school years?
Yes, sir.
When are we going to do another interview with the teachers or another questionnaire or something to get an idea about how the teachers are feeling since they've been back and since they're going to go back?
We don't have a timeline for doing that. We'll do some more of that to see how things are going. Things have gone very well at the elementary level. And I anticipate things will go very well at the middle school level and ultimately at the high school level. We'll probably do a meeting with high school teachers like we did with the middle school teachers and meet with their principal and 2 to 3 teachers from each high school so we can actually talk to them in person, which works much better.
I believe I'd be more interested in all the teachers in a school than in 2. Because you got a faculty of 60, 80, 100, 2 out of that's not very good statistics. And I don't know who they would choose or how they would choose.
Well, we
I'm
picked.
kind of skeptical with that, Dr. Marshall.
Well, we picked one and they
teachers.
picked one. It's not possible for us to meet personally with all the teachers, as you know, because of the large number of teachers that we have. But we've used surveys, but there's some things you just can get from a conversation that you can't get from a survey. And I can assure you they didn't hesitate to say what was on their mind on Friday.
How many surveys have we done?
We've done, Terry, how many?
Yes.
So we had our third-party survey that went out about a month ago. We did a survey this summer. We did a survey of elementary teachers. No, we did a survey of all teachers. Then we did a survey of middle school teachers. So I would say 4.
Talking to them during the summer is a lot different than talking to them when the school year began.
Yes, sir. We did one during the summer and we've done one we've actually done 2 since the school year began for all teachers. And a second one for middle school only. We did a second one for elementary? I don't think we did. Second one for middle school.
What percentage of the response did we get from the teachers? One that we just did, or one that we did when they was in school?
The one we did for middle school, we got a response from, if you count responses with the number of teachers in brick and mortar, we got one from every teacher.
We're saying we had 100% response?
We had more than 100%, which is a problem in and of itself.
How would you account for that?
You did more than one.
No, you get more than one. How is that possible?
Because we do the surveys anonymously. And if we can't track the survey, we can't keep you from doing more than one. That's a flaw in the system if we do it anonymously without contracting for that.
I don't really understand how we can have more than 100%. I can understand that in an election, but I can't in a teacher.
It would be possible for you to fill it out more than one time. And it would be possible for you to do that inadvertently. It's possible for you to, perhaps you got it 3 days ago and you filled it out then and you thought, well, I didn't fill that out, and you filled another one out. Or there might be some other reason that you filled out more than one.
Much more.
Again, that's why we want to talk with teachers. We want to hear what they have to say and have a discussion about it and not just listen to responses on a survey.
When you
Now
talk-
the upbeat survey, the one we do with all employees, it is structured by that third-party vendor. We know you can only do one of them. It maintains anonymity, but the company tracks it so that you can only complete one survey.
How do we know when we're dealing with two teachers as opposed to a faculty of a school? You say that we've talked to teachers,
Yes, sir.
and that's what we've done. We've talked to two teachers in a school.
We have an expectation for our teachers of the year as a part of being the teacher of the year and being a part of the teacher forum to represent all the teachers in their building, to communicate information from us to them and from them to us, in addition to the communication that principals have. And we not only expect, we know that all the middle school principals met with all of their teachers. I think probably all of them multiple times. So we've gotten a lot of teacher input. We've not done any of this without some amount of teacher input. There are flaws with surveys. There are flaws with in-person. By doing a mixture of the things, we believe that we get the best input that we can possibly get.
Got an idea for elementary school students and teachers. And we're going to be, when we start on January the 4th, then we'll be able to have all middle school students in school for 5 days.
Yes, sir.
So I'm wondering how they are going to do. So I hope we'll do something that will give us an idea about our success or lack of success, those in school.
Yes, sir. We certainly will do that.
You know, we've got to get our students back 5 days a week if we're really going to be giving them something to do that will be beneficial to them. Because I'm concerned about what we've been doing, about how much they've learned. One idea of that has been, well, we got so many failing, but that was much more than we've ever had before.
Yes, sir.
So we said, that's alarming. So you took that and said, you know, we got to do something because we got way too many students that are failing.
We got to do two things. We got to remediate those students and we got to get them back in face to face more often, which we were already on the path to doing. As you recall, we had already begun that process with elementary students before we ever got the first quarter grades.
What do we base remediation on? When we say we're going to remediate, how do we know who we're going to remediate, how we're going to remediate, when we're going to remediate?
In objectively, there's the benchmark testing we do with all students. And subjectively, there's the teacher's judgment of who may need remediation beyond what that benchmark testing says. The benchmark testing is the starting point because it shows where your knowledge is deficient.
We should keep the board informed about this benchmark testing as to how we did it, who we did it with, and what the results are.
Yes, sir. That's what we do with.
Benchmark testing will begin when?
It's already begun. We've already done that.
Have we done benchmark testing for the high school?
We only do it in the EOC areas at the high school level. We've been doing this for a number of years, Coach, and generally speaking, as a part of the testing report that we give you each year, we share that benchmark testing data. We will do a presentation at the December CAL to show you some comparison data between this year's benchmark and last year's benchmark from the same time. Now, keeping in mind, it's two different groups of students. Obviously, this year's second grade, third grade was not the same as last year's third grade. So there's going to be some slight variance from year to year that would be accounted for by the fact that it's a different group of students. It's still a reasonably good comparison.
How much testing are we going to do? I understand it. We're not going to do the map testing.
If you all approve tonight not to do the 2 grades of map testing, which has nothing to do with this benchmark testing, We do the benchmark testing, and we do the testing that is absolutely required by the state of South Carolina. The benchmark testing informs instruction. The testing required by the state meets the federal requirements and the state requirements for accountability.
I have read what the parents are saying. One parent suggested that why don't we get a medical professional to come in and speak to the board and tell us what the thinking is from that. I know we go through DHEC, and I know we go through bond secures.
And Prisma.
Yeah, but it would be nice if I could have a doctor. I don't know what kind of a doctor, but if that person could come and inform the board from a medical standpoint how we're doing. And that's just a suggestion from me.
Yes, sir. In fact, the last two calls that we made before we made the announcement yesterday, one was to Prisma, the other was to Bon Secours St. Francis to see if they had any concerns about us moving forward, which they did not. Neither related to how we plan to move forward, nor related to the capacity at the hospital and or in their ICUs. So we talk with them frequently, and we particularly make a point of talking to them anytime we're moving forward on a path or changing a course in any way. And normally the people we talk to would be in most cases, the chief medical officer at St. Francis, and at Prisma, generally speaking, their infectious disease person or epidemiologist, and Dr. Traxler is the person we talk with at DHEC, who is now the acting medical director and is from Greenville, in fact, lives in Greenville.
I would like for the school board to be able to sit down and talk to a medical professional.
Yes, sir.
And I know y'all are doing very well in that, but I think about, well, people are saying, that's just us and we don't know very much because we don't talk to professionals. I know that our administration does, and our school board, not our school board, but our school upper level, they speak to them. I would just be wondering if there might be in some time in the future, if we could have medical professionals sit down with the board and let the board ask that person questions. And that's just a suggestion from me.
Yes, sir.
And usually when I read the parents' comments, they're either they love us or they hate us.
Yes, sir.
But this was one who I said, well, maybe that may not be a bad idea. But anyway, that's all I have. Thank you, ma'am.
Thank you, Mr. Suddeth. Mr. Lewis.
Thank you, Madam Chairman. Thank you, Dr. Oyster. Just a couple of questions, and I just want to make sure that I understood some of the things that you said. So if we could talk a little bit about student achievement, and Mr. McCoy, so I hear us saying that in the December Cal, we're going to get some data on benchmark testing. I assume we're talking about Mastery Connect. That's what we're talking about here?
Yes, sir.
T21, yes, sir. And so we feel comfortable. I mean, waiting until a presentation, but I'm just make sure I hear what you're saying. We feel comfortable based on looking at this preliminary benchmark data to say that student knowledge and student achievement this fall, not seeing a significant drop off from where those students would have been with last fall's cohort. Is that?
I might stick with the knowledge as opposed to achievement.
Okay.
Because I kind of take from achievement that might also be like performance in the classroom,
okay.
Which is probably more reflected in the grades.
Okay.
There is not a parallel huge drop like there was with the grades based on our preliminary analysis. We're not finished with it.
Okay, but when we met last, we talked about the grades, and we felt like the primary reason that the grades had dropped was because work had not been turned in.
That seemed to be one of the driving forces. Yes, sir.
Have we seen a significant amount of that work submitted since we last met? Are we expecting to see some of those grades improve?
We've not looked at that, but we're going to look to see before we give that report to you.
Okay.
I believe that lines up, if I remember correctly, the date of the CAL falls beyond the midpoint of the second 9 weeks.
Right.
We intend to pull it on the second 9 weeks to see what that looks like.
So
It also means we're not going to discontinue our remediation efforts. I don't think I mentioned that earlier. Because we're coming back in does not mean we will discontinue that. It will simply continue after school.
okay. The testing question that Mr. Suddeth asked, I just would like to ask maybe in a different way. I think I heard you say that we're only using the tests that are required by the state that are a part of our compliance with the federal law.
Yes, sir. Outside of our benchmark testing, which is helpful in teacher preparation for instruction.
I think I also understand from the State Department of Ed that they are seeking waivers for some of those tests as well. Is that?
That's my understanding. I'm not sure they believe that there's a likelihood that will prevail,
Okay.
but that environment may change later in the spring. We just don't know yet.
Right. I guess I wondered, and I know our committee chair just left, but so I'll repeat it to him. Just if you could just say to me, is there a role that this board and advocacy can take in maybe reinforcing those positions with our state and federal leaders in support of the State Department's waiver request?
I think that would be helpful because, again, if we're taking time testing, that's time we're not teaching. Now, again, our feeling, certainly the benchmarks are helpful because that shows where students are deficient and it's actionable. The tests that we do for compliance and accountability, they're more actionable than they once were, but they're really not that helpful, particularly based on when you get them back.
Well, especially when you're talking about students only being back 2 or 3 days a week, the fact that they would come back and then spend a considerable amount of time taking a test to see how they compare to kids in Iowa doesn't seem to drive instruction. And as I talk to teachers, it is incredibly frustrating that they would need to devote instruction time when it is even more limited to these kind of national tests.
I think for you all to advocate for that would be very helpful.
Okay. The last question I just have is if I think I'm hearing you say we have a plan to get our middle schoolers back by 5 days a week when they return from Christmas. And we are working to get our high schoolers back to more than 40% when they return from Christmas.
Substantially more than 40%, yes, sir.
Then I just want to make sure that I heard you say, though, unless our numbers increase, and I think you use the word skyrocket, I don't know how to measure that. So as we talk to the community, I mean, there is a chance that they could return from Christmas break with the intention of going back 5 days a week, and we might be back at 0 days a week.
Yes, sir. That's entirely possible. And it's just impossible for us to predict that. We don't know. Now, Thanksgiving may give us a little kind of an indicator of what might happen, but 2 weeks off and college students coming back in, families traveling, we just don't know. Now, again, we're going to talk to the hospital system, or what are they seeing? Are they filling up? That would be an issue. Or now we won't have internal numbers, but what does our community spread look like? And I think if we start approaching numbers that exceed where we were in July, that'd be very concerning. I wish I knew a number to say if it gets to this number, we do it, because that would make life easier for everybody involved in this. Parent, teacher, you all, and us. If we could say if that number right there hits 2,368, you shut it down. And unfortunately, there is no such marker or indicator. It's almost all judgment. And a lot of it does come down to how well can our healthcare system handle what's going on? And are we contributing to spread? Are we helping to minimize spread? And I think we're at a point right now, we're actually helping to minimize it. Because when you come inside the system, you're doing the things that the healthcare people say you need to do to minimize the spread. So at least some portion of the time, and now a greater portion of the time, people are inside the system. They're not great answers. I think they're good answers. I think the answers that we have are based on medicine and science, and I would argue reasonably good judgment. And that's kind of what we got. It certainly would be easier if there was a number, though. I agree with you.
So we don't have a number. We have some criteria that the board approved that then we kind of gave the superintendent flexibility on. I think I heard you say, though, if they return to July numbers, that's a place we can't.
Well, see, right now we're looking at our numbers in comparison to the July community number. We're nowhere near that number internally. But one of the issues we have coming out of Christmas is we don't have an internal number. So what we're going to say this probably pretty quickly. We need to be prepared, just like we might need to be prepared if there's snowstorm or ice storm, which has happened frequently the first week we get back from Christmas. We need to be prepared to do e-learning for some period there, just in case. Which in many respects is easier than a dual platform where they're trying to do both in person and e-learning. So we're probably going to say that and hopefully not have to use it.
The last question I just have is, we had the press conference. We talked about what we were going to do with middle school, and there were a number of families who were excited by that news. There were a number of teachers who obviously have concerns about that news. The group that surprised me were the number of people who contacted me from my area who were not excited about that news, who felt like we had kind of made a commitment to them in the summer that these were the criteria that we would use to make decisions about returning to school. And, we gave the administration flexibility to kind of step back from that criteria and make individual decisions. And because of it, our elementary school kids went back at a time when maybe the numbers didn't align with 5 days face-to-face in the plan that we approved. And now the middle schoolers are going back at a time that the numbers are even worse than they were when we started moving the elementary school kids back. And it really surprised me, the numbers. I mean, I was telling one of the other board members, I received 40 emails yesterday, and 2/3 of them were from parents who said, wait a minute, this isn't what we signed up for. So recognizing that we are comfortable with kids returning to school safely, and recognizing that things have been done to make it so that kids and staff can return to school safely. What sort of flexibility is there for a family of a middle school parent, a middle school student, to say, you know what, I think virtual is probably what I need to move back to? Has their window closed for them to move back to virtual, or is there kind of a reopening of enrollment for that family?
We are reopening that. We're putting them on a wait list. We were able to successfully, I believe, Mr. McCoy, if I remember correctly, as of Friday, we had moved every elementary family that wished to go to virtual, because we had some of them that didn't want to come back face to face. So if there are any on the wait list for elementary, they occurred after Friday.
There, yes.
We'll go through the same process with middle school.
Okay.
In fact, we're trying to find, I don't know if we have success with it, we're trying to find another 4 core teachers for middle school. They wouldn't get related hours, but 4 core teachers.
Trying to find 4 core teachers that are currently teaching face-to-face or 4 new teachers.
4 new teachers.
Become virtual
so
teachers.
We can increase the capacity on the virtual side. We have some space on the virtual side because we had some that moved back, and we have some that'll want to move back. So the first thing we do is we swap them out. Then we're looking to see, can we find 4 core teachers? And it might be possible. We prefer to get experience, but that's going to be awfully hard. We may be able to get some midterm graduates.
It took us 3 or 4 weeks to get all the elementary school kids who wanted to go back to virtual back. So
We stayed pretty on top of elementary. So as they came in, we placed them because we had plenty of room in elementary. Middle was a little bit more challenging in 6th and 7th grade. Now we have, as Dr. Royster said, we've identified some additional space, and if we needed to, we're in the process. Since that wait list goes back to August, we sent out a survey to those parents to say, did you still want to remain on the wait list? Or to come over the virtual, and some have now changed their mind. They don't want to come over anymore, and others are yes. So we'll be working through those lists the next 2 weeks.
okay, so we anticipate there being room for families that are currently on the wait list to move off of that wait list into the virtual program.
Yes, sir. We're going to do everything we possibly can to create more opportunities for them to do that.
Thank you.
Thank you, Mr. Lewis. Ms. Bush?
Thank you. That was one of my questions in here. Thank you. The opportunity for those concerned families to be able to switch back and forth, especially because I received a lot of emails too over parents being concerned on the middle school students being sent back. Also, is there opportunity for those teachers in middle school? Are we addressing those issues of someone that said, well, I was comfortable with 2 days, but now with 5 days, it puts my family more in danger? That would they be able to address the, concerns with the principal and be able to see an opportunity to move?
They can address those concerns. We would need for them to have some verified medical issue, either themselves or a family member that's occurred since this happened. We do certainly would work with them, but if they're simply uncomfortable, I'm not sure that's something we'll be able to work.
Okay. And then on the substitute pool, we talked about that we have approximately 700 active subs, plus those in the pipeline. Compared to last year, we had 1,642, which is that's kind of scary to see those numbers. But we felt like that's what was going to happen. When we have teachers that have to quarantine, is there I know that in some of the colleges, they are doing tests like twice a week for teachers, or is there a possibility that our district, because right now the process would be for them to just go wherever they wanted to go and get a test, right?
But we actually have an arrangement with Prisma to do the testing as part of their testing sites. They've expanded their hours. Julie, I don't think she's in here right now. Ms. Horton worked with them to set that up, and that, generally speaking, gets in most cases, a 24-hour turnaround. Sometimes it's 36 hours, and it's covered by our insurance, so there's no cost to it.
Right. That's great information to be able to have.
And we also have teachers who are quarantined if they're asymptomatic or they don't feel too bad.
Right.
We have them teaching remotely. Now, we still have to put a person in the room. The other thing that's helped to mitigate this, we moved, depending on what school it is, but district average, 30% of our students went to virtual. Now, we moved teachers over with them. We moved a handful of people over as administrators by grade level because of the 22,000 that we've got in that program. But we left all the other school faculty support staff in place at the schools. In some cases, they can't do the things they normally did. One that might immediately come to mind is the media specialist and the media clerk. So there are people like that have a lesser workload because the students are not there every day in the same number they normally would be, which is how we assign and allocate personnel. Those people are available to the principals to use as substitutes, and that's really one of the ways that we're able to get through this, because quite honestly, 1,642 substitutes was not enough on some days. But now I haven't pulled this, but I think anecdotally, although the COVID issue has bumped numbers, I think there are other numbers that if you took those numbers out, our attendance rate might be a little better than it's been being. But I haven't pulled the numbers themselves to say.
Interesting. Also on the issue of bus drivers, I think since we last met, there was a job fair, the challenges we face with our bus drivers, and now that we're going to be having all of our middle schoolers come back 5 days a week, and then also food service and custodial. Have we been able to?
We're still, I mean, obviously we're able to operate where we are. It's not ideal. We've picked up a few bus drivers, but not many. The last job fair, we had 100 people there. Of course, those are primarily for custodial, food service, and bus driver positions. You know, it takes us, I guess, a little more than 30 days to train a bus driver and get them in place once they sign on to complete all the required training. So we're making a little progress with that. Probably the middle school return to 5 will not make any more, we don't believe will make any more middle school students late beyond the number that we were looking at, which was in the mid 600s. We don't yet fully know the impact at high school. It may exceed the 800 that we projected that we are currently looking at. So that again, that's just another challenge. And we're still at 67% capacity for the buses we are operating.
And what about the safety
Our
issue?
ridership is down, so that's helped that.
What about the safety issue as far as the bus drivers being able to have that plastic barrier?
Well, they've said they're going to have those installed in November. Is that correct? Now, that's the state is providing that. The state shops are installing it in on the state buses. Are ours in place on our magnet buses yet? Okay.
So that could basically be something that we could use to attract those that might have that concern of the students.
What we're hoping is that perhaps it might attract some back that
right, the ones that left, right, and the ones that
better.
And the ones that maybe are hunting jobs, but that would be, you know, as I said before, I think that bus driver position is probably the most exposure to students because there's no way to get them on a bus on and off and on and off, and they're passing that bus driver 4 times a day, and they're you know, so
I think we would concur that is probably our most potentially risky position because of what you just described.
And also, I would say that as we go into the holiday season, and I know that our communications department does an excellent job, but I think that anybody listening to our voices now, any personal involvement that we have, any communication we can make with the public of how everyone stepped up in July when no one thought that we would ever be able to start. And I see from the facts here in this report that we were one of the only ones from that consortium that actually started not on virtual. And I think that's because our community stepped up and did what they were supposed to do. We brought the numbers down, and we've been on a good trajectory since then of being able to increase those days and make sure our students were safe, our teachers were safe, and ultimately our communities were safe. And beyond a doubt, we've created a safer environment, as you said, for them to be in school than to be out of school. And so I hope that as we communicate and people start to celebrate, oh, the elementary kids are back, oh, the middle school students are going back. Let's also keep just badging away at the fact that do what our health professionals have asked us to do within our community to be able to keep these students in there, and for us not to go backwards to maybe shock all the prognosticators that say it's going to be a terrible holiday season and that we're ready to bunker down again and everybody stay home and e-learn. It only takes you wearing your mask, washing your hands, and keeping that 6 foot away. The environment that our children have learned to live in now, if we can just do that for the first of the year, we're well on our way to all of our students staying in school, getting the help they need because they weren't in school, and working toward those spring months when we hope this goes down and we hope that there's a vaccine in sight for us. So don't make sure that none of us hesitate to sing that to the community, that we feel like that they'll continue to have good actions that result in good behavior, that result in good numbers at our next meeting, that result in our students being able to come back to school after the holidays. Thank you, Dr. Royster. Thank you for the report and the detail and helping us know far more than what we want to know about COVID.
Thank you, Ms. Bush. Ms. Wells.
Thank you. I'm glad we're not using the same plan that we had in July because there's a lot more that we know now. There's a lot more data to use, and I'm glad that we're finding ways to analyze what we have in front of us. I think it would be unwise for us to just say that the path we thought we needed to be on in July is the same one. So I hope that parents recognize that they can look at this data and understand all the numbers, that what we're looking at now is better data. And we can see the trends better. Help me remember, I'm really glad we're moving away from that percent positive rate, because that was really a bothersome statistic to try to use. The data that we're getting for all the cases and to come up with the trends and the incident rates is coming from where?
The county and the state comes from the DHEC report, and we use the 2-week summary that they issue every Thursday. Our numbers come from us because they are more accurate sooner. They're literally almost real-time numbers. A report we might get today, DHEC might not get that same positive report for 2 or 3 days. So we utilize our internal reporting on the cases reported to us. Now, Janet is, she's cross-checking that with DHEC numbers to make sure we're not somehow way under, and we're not.
Okay, so that was my question, because there have been, with all the emails we're getting from folks, particularly people who love us now hated us 3 months ago, and vice versa. We can't make everybody happy. Everybody
Popularity is a fleeting thing.
But if some people would be concerned about, or have said that they're concerned that we aren't really accurately projecting the numbers of cases we have in our schools, because we just don't know. So if you're saying we are checking our data, we're using our internal data, but we're checking that against what the county has and what the state has, and we've been in alignment as we're looking at that data.
Numbers are almost always on a daily basis going to be larger because they're real-time numbers.
Okay.
It's not to our benefit to under or over report. I mean, we want to make decisions based on what the numbers actually are.
And in cases where we have students that maybe are out that haven't reported to us that they've tested positive, do we have a way to try to get to some of that information? If it's true,
we ask them questions, and quite honestly, we've had some that didn't immediately report as they should. And fortunately, somebody else has decided that they need to let us know that. In fact, there are at least 2, if not more. I know there are at least 2 quarantine situations in there that had fairly high numbers of quarantine because a parent, unfortunately, knowingly let their student athlete come and be a part of a game or a practice. We found out about it, but didn't find out about it until after they'd already been. Those numbers are in there. But I believe that most people have been very honest. They want to make sure that their children are healthy and other children are healthy and that our employees are healthy. So fortunately, I think those are rare instances, but it does, and it has happened.
And I think it just bears repeating again, I think maybe the third time, but the ratio number that we have, the calculation we have shows that it's a healthier environment in terms of COVID spread to be in the classroom than it is to be out in the general public, not in the school setting, right? That's basically what our number, that risk ratio you talked about, that's kind of what we're saying.
Yes.
So I think while I understand people are uncomfortable, and I understand they had in their head what their new normal was supposed to look like so that they could operate safely, there's just no such thing at this point. And we're going to be on this kind of continued evolution of how we go about looking at our data. I guess the question I have for you, you said since we won't have data after the holidays, that 2 weeks, we won't have our in-school data. You are going to revert totally back to looking at the community spread, or
we would look at the community spread. We'll talk to DHEC. We'll talk to Prisma. We'll talk to Bon Secours. At some point, they just have to make a judgment call, because I don't think there is a hard and fast number. And our disadvantage is for that 2-week window, we got no internal numbers other than we are saying to our employees. In fact, I think something went out to principals and department heads earlier this afternoon, right, Dr. Turner, asking them to continue to report, no matter what day it is, to continue to report. Now, we'll get the DHEC reports of students, but it wouldn't be real time. It won't be, so the data will not be as complete as it normally is. And that DHEC data sometimes runs several days behind. So we don't have what we believe is a really good set of data that we continually are doing. We're going to have this 2-week gap where we don't have that really. Probably a better way to look at it is we don't have the best data, and we don't have data that's comparable to what we normally are seeing.
Okay.
We'll have some internal idea. We got the external. Then we got, as President saying, look, we're about to get overwhelmed in ICU. We don't have enough bed. What might they be saying about the impact?
but you are kind of mitigating that by what you're saying you're going to ask employees and staff to do, which is continue to report.
Yes.
So if their cases rise, that's a number that we can use.
Right.
And really that DHEC, it'll be a week lag, right? So it'll be a week of us when we were still in school and a week when we weren't in school.
Yeah, but we may can get some daily numbers for them, but their daily number today might be a 3-day ago that we would have gotten 3 days ago internal.
Well, I think we have to keep pressing forward, and we have to keep looking at the data and keep evaluating. Is there a different way we need to look at it? Every medical professional has an opinion, and they differ. A lot of them differ. So, from the standpoint of having people come in and talk with us, or, you can get people to come in and tell you whatever it is that you might want to hear. So I think staying true to looking at the data, looking at the numbers, talking about the things that matter, like the number of hospital beds, moving forward with that understanding is important, because the thing no one talked about yet today, so I'm going to have to say it, is there are so many reasons why our students need to be back in school beyond adhering that they're safer in terms of COVID spread. The social emotional toll on parents and on their students in trying to navigate through this pandemic, their educational attainment has just been tremendous. So it's not ideal. People don't like the mask. They don't like the plexiglass, but putting them back in a place where they can learn and they have the support they need to learn is the right thing for us to do. So thank you for your work on that. And I look forward to seeing those benchmark data in December. Thank you.
Thank you, Ms. Wells. Anyone else? Dr. Royster, I have one question that I have received a couple of emails from. Oh shoot, where is my? Here it is. If a parent sent in the opt-out application, will they automatically get in second semester? Do parents need to let the school know?
I'm not sure I understand their question.
So I think there was an application that went out, you said in November?
Is maybe their question
They want to
about,
opt out of virtual. And
they want to return to brick and mortar.
Exactly.
Okay. They can
wanna-
only do so if we determine there is a space for them to do it, because us bringing them back 5 days a week is all based on a calculation of how many students are there. So if somebody, like I said earlier, if somebody wants to leave brick and mortar and they want to go back, we are and will make those swaps. So
Okay.
there is a process for them to follow, which Jeff would be for them to.
They would have gotten a survey. Basically, it says, you were on the wait list. Do you want to return? And that's what's coming in now as far as, yes, I want to return, or no, I don't.
But they've got to
And they
have
go, yes,
indicated.
they want to return. Do they need to contact their home school?
We will contact the home school, who will then contact, if we tell this home school there's room for that child to come to virtual, they will reach out to the parents.
Okay.
I guess the key there is to make sure they've actually sent that opt-out form, just, and if you want us to follow up with them, if you'll give us the contact information, we'll have
I
somebody
will
follow up.
do that, Jeff. I'll get back to you.
Okay, great.
Thank you. Anyone else? All right, we will, thank you, Dr. Royster,
Yes, ma'am.
for your
Thank you all.
update. We appreciate all the information. And at this time, the meeting is over, and we will take a 25-minute break before we go into executive session. I think you have to go to Chick-fil-A.
Nancy, where's Chick-fil-A at?
And they didn't put nuggets on there.